Well, Indiana University is marking its 2-year anniversary of waging war on opioid abuse. IU launched the Responding to the Addictions Crisis initiative in 2017 as part of the school's bicentennial Grand Challenges program. Here now to update us on the progress and the challenges ahead, Business of Health reporter Kylie Valletta. Kylie.
Thanks, Gary. Some 200,000 currently employed Hoosiers are suffering from substance use disorder, and experts say the crisis has cost the state $43 billion in economic damages. IU's initiative, Responding to the Addictions Crisis, is the nation's largest and most comprehensive university-led response. As it marks the 2-year anniversary, leaders are reflecting on some of the progress made. Here to share her perspective is IU Associate Professor of Counseling and Educational Psychology, Ellen Vaughn. Thanks for coming to the show, Ellen.
Thank you.
Before we talk about some of the progress made, talk first just an overview of what the initiative is and how it really brings a lot of different people to the table.
Yeah, so one of the things that's really wonderful about this initiative is it recognizes that we're all in this together. And so what IU has done is it's brought together an array of IU faculty and then partners with business, nonprofits, and government, and bringing together to do projects in a number of different areas, including groundbreaking data analysis and data collection, education and training, policy, policy development and implementation, and also workforce development.
A lot of different people involved, and it's big funding involved, also $50 million.
Yeah.
So it's the 2-year anniversary. How do you measure progress so far?
Yeah, well, this is a great question. So one thing is we have some statistics that are telling us that there's been a significant decrease, a 12% decrease in opioid-related deaths in Indiana. So that's kind of broad, but also specific to the initiative, we have faculty working with 144 different community partners across the state. So, and we expect that to grow as we continue to work on these projects. We've been training healthcare workers. We have a number of initiatives, including an ECHO project, which is really video conferencing between healthcare providers around issues related to addiction, such as HIV or hepatitis C. We have one of my colleagues here at IUPUI, Dr. Tamika Zapolsky, is providing counseling in the schools to students who are at risk for substance use disorder, and is working to really expand that work into other schools in the area. And then another initiative is really training folks in the workforce, but also students who are training to be nurses around what they need to know around addictions. We're also doing a lot of naloxone training. So we're seeing that we have lots of partnerships in many, many corners of the state.
And talk about your project, which is focused on training more counselors to have specialize and specialties in addiction counseling.
Yeah, so as a psychologist, one of the hardest questions that I get asked is, where do I send my family member for treatment? And oftentimes this is a really hard question to answer, because I know that in some parts of our state there really aren't enough addictions counselors. And specifically in Indiana, for every 1,000 persons with a substance use disorder, there's only 20 addictions counselors, and that's well below the national average. And so we know there's a lot of unmet need. So I'm very passionate about sort of training counselors, and so what we've done is we've put together an addictions counseling program that really aims to meet some of that need, that workforce need in the long run. And so this program involves coursework, addiction-specific coursework, but also supervised clinical experience in the community. So we have a number of partnerships, existing partnerships, and then we will also be growing those partnerships so students can get that really frontline experience and clinical training.
And you mentioned that you've been working on that, and it's going to get off the ground next fall and ready to launch. So.
Yeah. So we are about to open our application cycle and have our first group of students who'll be taking those classes starting in the fall.
Definitely a big need for counselors. Thank you for being here and telling us about your project and about the initiative.
Yeah, thank you so much.
Gary, back to you.